Nelson Lopez, roll 2, take 2.
Right? When people ask me what's community health, I like to tell the story of this person that was walking along the river, and then he saw somebody drowning. So he jumps in the river, take the person out of the water. And when he turns around, there was another person drowning. So he jumps in, gets the other person out. He turns, and there's another one. And there were so many that he started hiring people to get people out of the water. He got his housing and everything to get people out of the water. And it was so much. He has a small little company to get people out of the water. And then one day, he started walking upstream to see where's all these people coming from. And he saw this huge bridge with a hole in the middle. So people was going down the hole. So they fixed it, and there was no more people drowning. And that's what we do.
Living on the streets is pretty hard. If you can imagine going camping, but then you never come home from camping. So you're constantly trying to figure out, where do you wash? Where do you do dishes? How do you cook? Where do you sleep? Who's going to let me rest and not call the police? To add on to that, any sort of mental illness or medical problem, it makes it really incredibly difficult.
And that's where, our staff, we bring in social workers, we bring in behavioral health therapists. Everybody works together very cohesively to ensure that people are going to succeed and be healthier as an outcome.
And it's what I love about doing our job is that we stop every single person, the nurses, the mental health, the doctors, the front desk, people who volunteer and help with eligibility, stop and see a person and really look and connect with that spirit and that soul and accept them.
At the site that I go to, I see a lot of people that come from places that just have no idea how to even access, where to begin. How do you begin searching for, a place, a healthcare home? Neighbor Care is right there, big, huge banners, everyone welcome. And when you go in, you see it and you feel it.
Some patients, they come in, they're angry because they've been told no, 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 no all the time. And then when they come there, the look on their face, you could tell they're relieved to know that there is some place where someone cares about me. I do matter regardless if I can pay or not. And I think for them, it's just like an escape. I know I can go to this clinic. I don't have to worry about paying. I'm gonna be treated like a human being, not based on what my insurance or how much money I can pay.
It is a home away from home. It is a place where they feel safe, where they feel accepted, where they feel someone's just really looking out for them.
Just throughout the care that I received during my first pregnancy that ended in a stillbirth, all the midwives that I worked with through Neighbor Care, they really sat down, and I never felt rushed talking to them. They really sat down and allowed me the time to process through this time of grief. I felt like that was something that was very touching to me and to the rest of my family.
I'm 19, I'm a college student, and I'm in college only because of scholarships. So education's covered, but healthcare is not. And without Neighbor Care Health, I would have no healthcare.
The majority of the people that we serve are those that they don't have any other option. So if Neighbor Care were not here, then where all those people are gonna go?
There would be a lot of emergency room visits. There would be a lot of severely out of control, chronically ill patients.
I would be lost. I would actually probably not be here doing this if it was not for the quality of services through Neighbor Care.
I know we treat people with dignity, and I would be frightened of what that would mean if that wasn't around.
I don't necessarily know the reasons why people are here, but in general, I think we all have the same reasons to help people in need.
We are Neighbor Care Health.
We are Neighbor Care Health.
We are Neighbor Care Health.
We are Neighbor Care Health.